Okay. I'm calling this hearing to order. Good morning. My name is Kenzie Bach, and I'm the Vice Chair of the Committee on Housing and Community Development. I'm standing in for Councillor Edwards today, who had a conflict arise. In accordance with Chapter 20 of the Acts of 2021, modifying certain requirements of the open meeting law and relieving public bodies of certain requirements, including the requirement that public bodies conduct its meetings in a public place that is open and physically accessible to the public, the City Council will be conducting this hearing virtually. This enables the City Council to carry out its responsibilities while adhering to public health recommendations and ensuring public access to its deliberations through adequate alternative means. The public may watch this meeting via live stream at www.boston.gov/city-council-tv or via broadcast on Xfinity 8, RCN 82, or FiOS 964. This public hearing is being recorded and live streamed on boston.gov/city-council-tv. And again, those channels, Xfinity 8, RCN 82, and FiOS 964, and it'll also be rebroadcast at a later date on those channels. If you're watching and you'd like to testify on this matter, please email juan.lopez@boston.gov for the Zoom link. That's Juan, JUAN.Lopez, LOPEZ, @boston.gov to get the Zoom link and come join us here. Today's hearing is on Docket 1010. Docket 1010 is a message and order authorizing the City of Boston to apply for and to accept and expend the Federal Fiscal Year 2021 Continuum of Care grant funds from the U.S. Department of Housing and Urban Development in the amount not to exceed $45 million. These funds will be used to support programs that provide services and housing to persons experiencing homelessness. This matter is sponsored by the Mayor, and it was referred to the Committee on Housing and Community Development on September 29th, 2021. In addition to myself, I am joined here today by Councillor Ed Flynn, the District 2 City Councillor, and Councillor Julia Mejia at large. So welcome to both of those colleagues. And we will be hearing today from Lila Bernstein, the Deputy Director for the Supportive Housing Division of our Department of Neighborhood Development, about the use of these funds. So before I go to Lila, I'll just give Councillor Flynn and Councillor Mejia a brief moment to say a word of welcome. Councillor Flynn.
Thank you, Councillor Bach, and thank you to the panelists for the important work that they do every day for the residents of Boston. Looking forward to hearing more about these grants. Thank you, Councillor Bach.
Thank you, Councillor Flynn. Councillor Mejia.
Yes, good morning. Well, good afternoon at this point. Oh, Jesus, yes. So thank you to the chair for holding this hearing. This topic is near and dear to me. You know, as a child, everybody knows that I bounced from home to home. And it wasn't until the 5th grade that I actually had my own room. So I know what it's like to feel housing insecurity. And it's great that we're applying for the Continuum of Care grant, and I hope that our application is approved. I do have some questions, though, about our vision for this grant, and I hope to get them answered during the question and answer portion. So thank you.
Perfect. Thank you so much, Councillor Mejia. Yes, and I would just agree that, I mean, this is the issue of housing and services for unhoused folks is top of mind in the city right now. It obviously became an even more acute focus in COVID, and is an area where, you know, the top line number here is very encouraging, the sort of $45 million. I think one of the things we'd love to understand at the committee is how much of this is for the continuation of services that we already do, because I know there's really substantial stuff that the city has started doing in recent years that Deputy Director Bernstein really is our point person on, and then to find out what, if anything, kind of new and additional we're able to do with these funds would be great. So with that, Lila, I'll pass it over to you to talk to us a bit about this grant and its purposes.
Great, thank you. Can you hear me?
Yes.
Okay, thank you, Councillor Bach, Councillor Flynn, Councillor Mejia, and any other member of the council who joins us. My name is Lila Bernstein. I'm the Deputy Director of the Supportive Housing Division at the Department of Neighborhood Development. And as you've stated so clearly, I'm here to talk about the Continuum of Care annual funding that is used primarily to fund housing programs and infrastructure to help Boston end homelessness among families, youth and young adults, and individuals. And I want to thank you all for your leadership and partnership and support on this mission, which you all have provided in different ways over the last several years. You should have received a fact sheet about the grant program, and it's a little bit convoluted. So I'll give a summary and then happy to take questions at the end. And I will also try to weave in a response to the question that's already been posed about how much of this is new funding versus funding that's continuing work that's already happening. So the Continuum of Care program is a grant, and I might refer to it as COC, but that's the Continuum of Care program. It's a grant program awarded by the U.S. Department of Housing and Urban Development to provide housing and supportive services for homeless individuals and families. HUD awards this funding through an annual competition. This year's competition closes on November 16th of 2021. So the Boston Continuum of Care is coordinated by the City of Boston's Department of Neighborhood Development Supportive Housing Division, which is the division that I am coming to you from. And we get direction from the Continuum of Care Leadership Board and consumer advisory groups. So both on our leadership board and then from two specific advisory groups, we have a host of people with lived experience. One of our advisory groups is the Youth Action Board. So these are young people with lived experience of homelessness. And then Back Home, which is the Boston Advisory Council on Ending Homelessness, which is comprised of adults who've experienced homelessness in Boston. And so the direction for how we use resources and how we target resources comes from the board and these consumer advisory groups. The current portfolio includes 42 grants and serves currently over 2,000 households at a given point in time. And each grant term is 1 year. So D&D will apply to renew existing grants and submit applications for new grants. And I'll get into details a bit lower down. So the funding is used to assist individuals and families that meet the HUD definition of homelessness. So there's a very specific definition of literal homelessness, but I do want to be clear that these grants are targeted to people who are, sleeping in shelters or sleeping outside or staying in a place not meant for human habitation. These dollars aren't used for preventing eviction or, serving people who might be doubled up or bouncing around, or what some people call couch surfing. These dollars are specific to people who are experiencing literal homelessness already. There are certain component types and programs and specific homeless subpopulations can be targeted for assistance, such as youth and young adults, veterans, survivors of domestic violence, and people with disabilities. So this year, Boston's eligible for approximately $38 million in renewal funding. So that's the portion of the grant that we already have programs allocated, and we are renewing those programs so that they can continue. This includes 25 permanent supportive housing projects. So that's long-term housing vouchers along with supportive services. It includes 11 rapid rehousing programs and what we refer to as, or HUD refers to as, joint rapid rehousing transitional housing programs. So these are programs that serve people with rental assistance on a time-limited basis in the private market. And then there are 5 grants to support the infrastructure of the city's homeless response system, including technology and data systems to capture information on people experiencing homelessness. And then last, there's a planning grant to support a coordinated homeless system response. So the $38 million that we're renewing, like I said, I'm sorry, $38 million that we're renewing, those are for existing programs. In addition, Boston is eligible to apply for $1.9 million in new projects for housing and services for homeless households, and another, on top of that, $2.2 million to create projects or expand projects for housing and services for households made homeless due to domestic violence. So those are the new dollars, $1.9 million for housing and services for people experiencing homelessness and $2.2 million for people who are experiencing homelessness due to domestic violence. And so to determine how those dollars will be used, the city issued an RFP that was issued through the Department of Neighborhood Development, and then we are reviewing those applications for inclusion in the application that will be submitted to the federal government, submitted to HUD in the middle of November. So that's the summary, and I'm happy to take questions now.
Great. Thank you, Ella. I think I will go to my colleagues first and sort of wrap up with my questions after they have a chance. So Councillor Flynn, do you want to start out?
Yeah, thank you. Thank you, Council Bach. I know, Lila, I worked with your office and with Sheila Dillon and with Mayor Walsh and Mayor Janey on providing our homeless veterans with an opportunity to get housing and services. Would this have any impact at all in assisting homeless veterans?
Yes, so in the $38 million that are being renewed, there are programs that specifically target veterans experiencing homelessness. So there are some programs that are, they complement other funding that focuses on veterans, but there are some programs that are filling gaps in the system that, you know, some of the funding that comes through the VA or that comes directly to the housing authority specifically to house veterans. If some of those funding sources have restrictions, and so we have additional programming in here for veterans who wouldn't be eligible for those other programs.
Okay, no, that's helpful, Lila. I appreciate the work your office has been doing on supporting veterans that are homeless. So I know we have a lot more work to do. We made a lot of progress, significant progress, I should say, but certainly there's more work to do. But again, just want to say thank you to your team, to neighborhood development, and working closely with the city council and mayor's office, obviously, but the residents of the city. So again, just want to say thank you. Councilor Bach, I don't have any further questions or comments.
Great, thank you so much, Councillor Flynn. Councillor Mejia?
Yes, thank you for giving us a very thorough deep dive in terms of the how and what. I do have a quick question. It's a follow-up in regards to, because one of my questions was specifically around folks who are couch surfing, you know, folks who are chronically homeless, right? Even though they technically always find a space to squat, they're still homeless. And so just kind of just curious about how are we going to, if there's an opportunity to use this money to think about all kinds of homelessness. And I think that you mentioned that we weren't looking at folks who were couch surfing. Is that true? Did I hear that?
Yeah, I think the way that it's framed in the rules is that in theory, this funding could be, you know, once you end homelessness and kind of meet certain benchmarks on making homelessness rare, brief, and non-repeating for people who are already homeless, you can start to pivot and use some of these dollars for what HUD considers prevention. But until that's the case, these dollars need to be targeted on people who are already kind of in a shelter or sleeping on the street.
Okay.
So yeah, so that's the distinction. There are other funding sources that we have in hand now that are able to reach populations who are in that situation of couch surfing or doubled up, and you're right, that can go on for years, sometimes a lifetime, right? Mm-hmm. So it's not that people in those situations are just experiencing it for a short period of time. That can be a very long-term situation and very unstable. But this funding source is not targeted for that population.
Thank you for that. So I just have two more questions, and then before Councilor Bach gives me the gavel. There are a lot of folks who are being unhoused as a result of domestic violence because their families cannot accept the LGBTQ plus status. And I'm just curious, how are we working specifically with women and members of the LGBTQ community, and particularly the trans community, around some of these housing needs?
Yeah, absolutely. And I think there's a lot more work we need to do. There's currently an effort that we have some of our technical assistance providers helping with that's being chaired by the executive director of Street Inn and Jerry Thomas at Boston Public Health Commission to look at our look at our shelter system and the issue of how people who are trans or LGBTQ are kind of look at the environment for people who have those identities has been one of the topics that's on the table for that shelter transformation visioning. There is a grant that we have right now through the recovery dollars that could be used to transform or to alter or renovate shelter spaces or even purchase shelter spaces. And so that's the context in which we're asking that question. I think in terms of how we're responding to people fleeing domestic violence. That's part of what these new dollars can be spent on is housing responses to people who are experiencing homelessness due to domestic violence. And we did receive applications that total more than $2.2 million for that. So we will have an application that goes into HUD for that additional programming that will be housing responses to people who are homeless due to domestic violence.
Okay.
And then your question also was about women experiencing homelessness. And there is right now there's a subcommittee that's looking specifically at that question. And it's got participation from Boston Public Health Commission and the major shelter providers and Rosie's Place and Women's Lunch Place and the Department of Mental Health, looking at, and Healthcare for the Homeless, many others, looking at specifically how are, women being served, women who are experiencing homelessness being served. Yep. And there's kind of two cohorts that people have been looking at. There's younger women who are, experiencing specific issues that might be more related to sex work and addiction. And so there's a group kind of looking at the needs for women in that cohort. And then there are older women who, are kind of stuck experiencing homelessness and may have longer term mental health disabilities that are not being addressed properly. So there is a large group of people looking at this, but I don't, and out of that work, there's been an effort to create a safe haven for women who are experiencing homelessness who also have serious and persistent mental illness. But I'm not sure I'm answering your question. So
yeah, no, it's okay. It's okay. I keep thinking about the public hearings that we do during the budget season, and I keep thinking like, oh my God, I got 2 more questions that I want to get in before I get muted. And so I just am like, I got it, and I just want to make sure I get these 2 extra points. Is that okay, Councilor Bach? Do I have time?
Yeah, totally, Councilor Mejia. Take the time that you need.
Okay, thank you. So just wanted to uplift 2 more things. The Transgender Emergency Fund has been working for ages to get a physical location. And I know that Councilor Campbell and our office has been involved in that process. And I'm wondering if there's any opportunity to partner with them by utilizing some of this funding to help support that effort. And then the last thing is that, we talk a lot about youth who are homeless. And, there's a lot of great programs out there that exist. There are 2 segments of the population that I'm very concerned about. And I'm just curious about what, if any, opportunity exists to support. It's young people who are transitioning out of foster care. There's really no safety net for them once they reach, once they age out. And then young people who are transitioning out of DYS. So I'm just curious about what if anything exists to support these 2 very specific populations. And then if you could just talk to me a little bit about the Transgender Emergency Fund efforts.
Yeah, so I'll start there. This particular funding cannot be used for a shelter space, but like I said, there are other buckets of funding that we have available that could be. So I think we should connect about the other available funding to see if there's a match there for the Transgender Emergency Fund space question, and that is something I've heard about for several months now. So I do think we should connect on that. This funding is prescribed to be spent on housing interventions. So in terms of young people who are transitioning out of foster care and young people who are transitioning out of DYS, this funding does and can support housing interventions for youth who are exiting those institutions and entering, they would otherwise be entering literal homelessness. So there is a set of these dollars that are renewing that are specific to youth and young adults. And some of the providers involved also have expertise in that population of youth who are exiting institutional care, essentially.
So can you talk to me a little bit about, because this is where I always like to say that I have a growth mindset, so I'm always learning. And the people who follow us are also learning alongside us. But when you talk about having these dollars set aside to support, can you just go into some level of specificity, if you have any, like how many dollars, how many young people, and which organizations are you working with when it comes to supporting the students who are transitioning out of foster care and DYS? Because I think oftentimes these kids get lost in the sauce, and there's really very little communication around the initiatives that exist. And I'm sure that they exist. It's just having the information so that we as an office can help disseminate might be helpful. So even if you don't have it now, at some point, if you can get to our office, just like, who are the organizations that you're working with? How can we plug in young people who we know are vulnerable and are transitioning out into the streets because they don't have anywhere else to go? And how do we set them up for success? Because if we're really serious about addressing a lot of the issues, and especially around poverty and violence and all these things, can just continue. It's just a spiral, right? It's like all these things are interconnected. And so making sure that students, young people come out and are set up for success can help support them on their journey. So I just would love some ideas about what that looks like for your department.
Absolutely. So why don't I, instead of kind of giving a general answer, why don't we get a specific set of responses to the numbers observed, exactly how many dollars, which are the providers, and specific programs for young people who are transitioning out of care.
Yeah.
And we can get that to your office so that
would be great. And then I'll say one last thing. I know, Councilor Bach, I'm hijacking your entire hearing here, but there have been several constituents that we have literally have had to cover their hotel lodging because they were either waiting for a rental voucher or they were waiting for inspection or whatever the case is. We've seen ourselves in situations where we've either had to find resources to help support our constituents during their most vulnerable time because they're homeless and put them up in hotels. And I'm just curious about what, if any, opportunities, or if there's a fund set aside for emergency shelter for folks, especially our elders. And I'll just say that the incidences that I'm sharing more specifically have been for elders who found themselves homeless, literally, and that were also dealing with medical conditions. And so that we've had to help support them with some of their housing crisis. And we've worked with Sheila and her team, but oftentimes the funds are not there. So we've had to be creative and find funds to help support. So I'm just curious if there's a way to set aside some funds for some emergency situations, specifically for some elders, and then also people who have experienced or have witnessed homicide and folks who have experienced trauma. That's another area where they may not be, they're unhoused, or they can't be in the environment anymore. I mean, that's probably something else. I'll just forget that one. I don't know if it falls within the context of this work, but that's just another scenario that I've encountered.
Yeah, absolutely. So there's a very small program right now that works with elders through ESAC. I don't know if you've worked with them at all, but it's managed through the Office of Housing Stability, which is our sister office. But I know that specifically elders with complex medical conditions, there's not always enough resource. So I will absolutely, mention that to Sheila and to others. And I do think as you have cases that come in like that, you should certainly reach out to our department and to the Office of Housing Stability to see if we have a placement available. But you're right, the hotel slots are very limited and often are filled up.
Yeah, well, thank you. And I so appreciate Councilor Block for allowing me to overextend my time, and Lila for your ability to just keep going back and forth with me. So thank you for all your hard work, and thank you for giving me the opportunity to learn. And I look forward to following up with you and your team to figure out some of the areas that we can potentially help support as well on our end. Thank you.
Thank you for your leadership and for your questions.
Yeah, thanks so much, Councilor Mejia, for all the specific questions there. They were all great, and all the work your office does on this too. Councilor Braden, if I just forwarded you to make sure that you have the sort of handout from Lila in her office, I can go to you now, or I can ask some questions of my own and then come to you in a minute.
Asking some questions of your own would be fine. I'm sorry, I apologize. I was on another meeting, so I'm a little late to the show here. Go ahead.
Sure. So, Lila, can you tell me a bit about, so I'm understanding there's, about 38.5 million is sort of the renewal stuff. And then there's another 4 million and change that's potential new programs. Or at least it's new dollars. So I guess my question for you is, in our RFPing, have we framed our RFPs in a way where we're sort of like looking to meet unmet needs in terms of like new program types? Or is it more about like, we need more people or like more spots for this thing we're already doing who can provide that? Like, I'm just trying to understand, is it how we are thinking strategically about the new funds?
Yeah, so we've had an oversight committee that has helped kind of determine how proposals will be ranked, and they are looking at what are the gaps within the constraints of the grant. What are the most pressing gaps in the system, and permanent supportive housing, of course, is like a priority because we all know there's not enough permanent supportive housing. Certainly serving people experiencing domestic violence is a priority, and there's dollars set aside for that population. And so, the proposals are primarily housing responses to, so it's either rapid rehousing or permanent supportive housing. Those are major gaps for our system. There is, preference given to projects that can come in and leverage services from elsewhere, because these are HUD dollars. There is an intention to spend the money as much as possible on housing, rather than funding services that potentially could be funded from other sources. So there's some push for leveraging Medicaid dollars or leveraging dollars from other departments that pay for the service side, but we are allowed to spend some of these funds on services as well. And in some cases, you have to, because there's not going to be the right service mix for the people that are being served, and you have to guarantee that there'll be the right services for people to be able to make the transition to housing and have it be as supportive as it needs to be for people to be stable. Does that answer your question?
Yeah, no, that's helpful. And I mean, certainly my analysis right now would be that, yeah, we don't have, I mean, it's not anything new, right? We don't have anything close to the supportive service like capacity that we need for housing. And I think one of the things that I've been hearing from housing providers lately is very much like the piece of the housing first instinct that is correct is that people don't solve any of the other challenges in their life when they don't have housing. So like they do need housing, and they need it in a low barrier way that doesn't involve jumping through a whole bunch of hoops and solving a lot of other things and finding a job and kicking your addiction and doing everything before you ever get housed. But then one of the things I've been hearing from folks is very much the kind of like, so in that sense, housing first, but also not housing only, because for a lot of folks, when you get them into low barrier, low threshold housing, if you don't then also have the supportive services there, people will lose that housing. And they won't be able to kind of succeed in the way that we hope. So I guess that's certainly what I've been hearing from everyone, I would say. And I just wonder, to that end, like how much of this resource are we able to use for supportive services that kind of can attach to existing like housing opportunities, and maybe if you could speak a little bit to, obviously Mass and Cass is on everybody's mind right now, and I think that that's one of the places where we struggle with folks who are they would accept low barrier housing, but they're not interested in sort of nightly shelter. So just helping understand from your perspective how that piece plays out here.
Yep, absolutely. So, I mean, HUD has wavered over the years about whether or not they allow the dollars to be spent on services. This year, there is more flexibility on that. So, we are able to accept proposals that are either funding housing and services or potentially even just services. And there is still an emphasis on, trying to create new housing with these dollars and not, or at least new housing support and not just services. So I hear you and I agree. I think one of the biggest gaps in our system is the supportive services network that is reliable, that you can, that anytime you have housing and people need services, that there's a way to get the services there. I think that's a major gap in our community and in our state, essentially. And there are some other places that have a tighter system where it's really clear where the funding source is going to come from services. And for Massachusetts, it's pretty piecemeal. And that leaves gaps for people. So, some of this funding may serve some of that gap, but we are directed to kind of create new housing as much as possible with these dollars as well. So what I'll say is, from the proposals that I've seen, most often there is some request for housing dollars along with some request for supportive services. So this isn't going to be, I don't think this new money is going to be used to go plug service gaps in existing housing, but it might create housing paired with services that would give the right package to people who are going to be housed with those dollars.
Got it.
Madam Chair, can I jump in?
Yeah,
Madam
please.
Chair, I have to jump off for another meeting, but I do want to sort of amplify, if you don't mind, I have to excuse me, pardon my introduction.
No, please, Councilor Braden, you have the floor.
I think this is a critical discussion that we have, and we should probably continue it further beyond this accept and expend order. The idea that our residents need some help with resident services coordination so that they can actually get access and get pointed in the right direction to other resources that are available that they're not necessarily accessing. I want to amplify Councillor Mejia's concern about young people leaving foster care and coming, it really does seem to be, you hit a certain age and you're out the door and you're on your own, and young people who grow up in stable families don't get thrown out the door at 18 and told to fend for themselves. So I think we have some work to do. And the other thing I'm seeing is elders on fixed income are being priced out of housing in Boston, and I think back to that concern about increased homelessness with our elderly population is very important as well. So I really want to thank you. This is an incredible opportunity, but I'd love to continue this conversation going on. And thank you for allowing me to jump in, Councillor Bock. I have to go to another meeting.
No trouble at all, Councillor Braden. Thank you, and thanks for that.
Thank you.
Councillor, sorry, Lila and Councillor Mejia, did you have another thing you wanted to ask?
Oh, no, I was just giving the thumbs up to Councillor Breeden in regards to our elders. My God, yes. I underscore the importance of being able to support, well, obviously, because the comment that I made earlier about some of our elders who we've had to support, but there are a lot of elders who are on fixed incomes, literally, who are struggling right now to be able to stay in their homes. And so with the rents increasing the way they do sometimes, I just feel like that's another vulnerable population. I just wanted to uplift and just, underscore the importance of making sure we support them as well.
Totally agree. Lila, can you tell me a little bit about the tenant, the rental assistance component of this? How is that administered? Like, does that take the form of federal vouchers, or does it, I couldn't quite tell from the spreadsheet how the rental assistance is administered.
Yeah, it takes a few different forms, but there are, in the kind of permanent supportive housing bucket, there are a few different ways in which the dollars can be used for essentially our voucher. We call them COC vouchers. And many of them, not all of them, but many of them are administered through Metro Housing Boston. And they do look a lot like other federal vouchers, although there are fewer rules around, there are fewer barriers to who can be served with vouchers. Then some of the dollars are are somewhat different, that they kind of go to a provider, and the provider can lease a unit and then have a sub-agreement with a tenant. So that's a little bit different from most federal vouchers. And then the rapid rehousing dollars are not like vouchers, really. They are short or medium-term rental assistance that are paid as a portion of a tenant or a family has a lease in a private market apartment. Part of their rent is paid for through the rapid housing program, and they pay a portion, but that may adjust over time, and it's time limited. So it's not a voucher; it's more like a support to help paying that.
Yeah, it's a sort of more one-time or time-limited sort of swoop in.
Yeah, I mean, it can be up to 2 years, but it's not it's not a voucher, because then it expires. It can't be past 2 years.
Got it. But on the COC vouchers, I actually think this came up in a prior hearing we had on this, but because they're Metro Housing Boston, does that mean that they're operating under the fair market rent payment standards that DHCD has, instead of the small area fair market rent payment standards that the Boston Housing Authority has?
That's correct. But the Continuum of Care grant does allow some flexibility. So there isn't always, there isn't a cap at 100%. There's flexibility that they can go above that if it is deemed to be rent reasonable for that unit. So
you have more exception payment standard capacity.
And we use
Yeah, I guess my question would be, if you guys, this would be sort of a follow-up thing, but just understanding, does that allow you to get to the same place as the SAFMRs do? Just because I know a thing that came up, he's off now, but when the last time we were discussing this topic with Councillor Flynn was the fact that, that people are not really able to use these COC vouchers in South Boston. I would guess because of rents, and I think that's probably true of most of my district and substantial other areas of the city. And it just feels like, I've been on a hobby horse to try to get DHCD to reconsider that decision for a while, and it's not Metro Housing Boston's fault; it's a state policy decision. But it would be helpful to know whether that's a barrier to accessing the housing stock for these folks.
Yeah, I don't know that, I haven't done the cost comparison to the small area FMR and how much flexibility we have within these vouchers, but I will say that the rules on these vouchers are not governed by DHCD, they are governed by HUD. And so even though they flow through Metro has to use the Continuum of Care rules for determining the rental share and how much the voucher can pay.
Okay, yeah, that's good. So if you just have a chance to evaluate on that, that'd be helpful to know.
Sorry, you did ask a question about Mass and Cass, and I'm happy to.
Yeah, I did. Yeah, if you have a chance.
Yeah. So a few things. So D&D's kind of role in Mass and Cass, and we partner closely with HHS and Boston Public Health Commission, and our role is really around housing interventions. And so we have currently invested in teams that are helping to assess people who are currently at Mass and Cass and provide rapid rehousing, which is, like I said, kind of time limited, but rental assistance to help people kind of move straight from an unsheltered situation to an apartment. And then from there, there is a policy with the Boston Housing Authority that if people are in a rapid rehousing program and they're assessed to need a longer term housing situation, they're going to maintain their homeless priority with BHA, so they can transfer. And then we also have a policy that if someone is assessed to be unstable in rapid rehousing and needs something deeper, that they can be assessed for these permanent supportive housing vacancies as they come up. And so they could transfer from rapid to PSH. So rapid, it's more plentiful because it's, each person, there's fewer dollars for each participant. And so that is one way that we can kind of more quickly deploy housing resources for people who are experiencing homelessness and sleeping out on the street right now. So that's one piece. Most of that funding is coming from another funding source, not from this particular grant. I mean, this grant is not specific to a particular neighborhood. It is for anybody experiencing homelessness in the city of Boston, and so that includes people who are sleeping outside and people who are in shelters. And then we have, through that board that I talked about, we kind of as a community decide how to prioritize resources, and essentially the prioritization to boil it down right now is based on how long someone has been homeless. And so the longer someone's been homeless, the higher priority they are to get the next housing vacancy. And so that is sometimes a resource that will reach people who are at Mass Ave and CAS, but not always. And those resources are kind of going citywide. The other thing I'll say about Mass CAS that, Sheila Dillon, Chief of Housing, has been working hard on recently is working to find transitional spaces for people. So, that's not typically where we kind of put our time and attention, but that seems, it's become clear that that's really needed right now for people who are suffering and unsheltered in that area. And so she's working with partners to try to find spaces that can be transitional spaces for people so that they're not waiting for housing on the street, but instead somewhere safe and able to kind of meet with people more regularly so that they can get a housing response.
Great. No, that's really helpful. And yeah, I think anything we can do, even in those spaces that we're not usually extending ourselves, it feels so critical. I think it's so hard right now to, when somebody is open for help, right? I mean, we talk about, when the moment where somebody's open is when you want to get them into, obviously drug rehab programs and stuff, but in many ways, the same thing goes for, access to permanent housing for people and with that appropriate supportive service. And so, yeah, I really appreciate all the work that you're doing on all these fronts, Lila. And I know it's it's kind of an overwhelming challenge. And we appreciate just the fact that you guys get up in the department every day and do it instead of letting it overwhelm you is really important to all of us here on the council. So thank you for that. Is there anything related to, I know that the city made some, has been trying to talk with the federal government about sort of its next big push on housing. Is any of that related to this, or is that a different? We signed up to be a federal partner on some housing thing.
Oh, House America.
Yes.
Yes. Yes. So there's a Biden administration effort. I think that's what you're referring to.
Yes, it is. No, that's the catchphrase. I couldn't remember it.
Yes. It's called House America. It's brand new. It was just launched last month, and the administration asked invited communities, and Boston was one of the communities invited to set goals around in two places. One, to set a rehousing goal, how many people who are exiting literal homelessness and are rehoused between mid-September and the end of 2022. And the second goal was a housing creation goal of how many units of housing would be created for people experiencing or households experiencing homelessness. And so I don't have the goals in front of me, but we set goals in both of those areas, and we'll be kind of rallying behind reaching those goals. And ideally, we'll learn from other communities who are also part of the effort about what kinds of things they're doing to, with new strategies or different ways to do as much as we can. There is a lot of federal funding flowing in. That's not just this grant. This is the grant that kind of exists year after year, unrelated to some of the new dollars. There are additional dollars that have been coming in that communities are using to innovate. And, we need to be in touch with other communities to see what else we could do that's different from what we normally do. I was going to say one other thing about it, but it slipped my mind. I don't know where that's.
Great. Well, if you have a chance to also send to the committee the goals on the two fronts for House America, that would be excellent. Yeah. And I think those are all, oh, go ahead.
Well, I just wanted to say I'm the spokesperson here, but I'm the middle woman, but really there's a team of 19 in the Supportive Housing Division that do incredible work every day. They get up every day and believe in ending homelessness, even though it's not ever easy, and they do miraculous work every day to keep our dollars flowing and our system working. And then there are hundreds of providers with thousands of frontline staff who were, not only heroes before the pandemic, but during the pandemic put their lives at risk to get people housed. And then we have these amazing advisors who use their time and wisdom to help shape our system. So I will pass on your gratitude to them because they're the ones doing this hard work every day and pushing us to be better and to think about how our system is looking at racial equity and measuring our outcomes in a way where we're getting better and better and more equitable as we move along and not just doing the same thing that we've always done. So we are, our system is evolving and becoming smarter, but also more equitable because of all the voices and people at the table who are pushing us to think differently and do the work differently, including all of you. So thank you for your partnership in this work.
Thank you. And thank you for that word in favor of that whole ecosystem that is just trying to uphold and push forward on housing justice. It's so important. And we're not gonna, I think there's some good political shifts in favor of housing justice, including at the federal level, but also here at home. But if we make any major progress on the political side, it will be building on top of the nonstop work that folks have been doing in the trenches on this for so long. So it's not all going to come out of nowhere. It's really that team that you lead. Councilor Mejia, did you have any closing comments before we go?
Yeah. So thank you so much for hosting this hearing. Obviously, we have to do it anyway, so it wasn't like you just did it because you wanted to, but this is part of the process. So thank you for facilitating, Councilor Bock. I just wanted to say, as we start really thinking about this work and funding and grants, and I always think about our return on investment. So it's always good to just kind of do these check-ins to see how the dollars are being spent and the outcome of these efforts, and who are the organizations that, kind of like the questions that I asked earlier about in terms of who are the organizations that you're partnering with. But I just think that, at some point it feels like, and this is just probably just me as someone who was once upon a time on the outside looking in, is that Boston continues to, it feels like we have the same conversation over and over and over again about housing, and the only thing that I always say that changes are the characters and our outfits and maybe our hairstyles, depending on kind of how we rock it. And I'm incredibly encouraged that we're moving towards a place where there's more intentionality around infrastructure so that we can really tackle the root causes of homelessness. Because what it seems like to me is oftentimes is the Band-Aid approach. And I think that we need to start really thinking about deeper work to address this, so that we're not spinning our wheels in this cycle of dealing with the housing crisis. And so I just want to offer that as something for us to just continue to marinate on. I used to volunteer at Project Hope, and used to do workshops with women who were transitioning out of shelter, because one thing is to secure housing and the other one is to keep it. And unless we're really doing targeted education and helping more specifically women understand the risks and sometimes the risk that we take or that we put our families in when we secure a voucher, when we secure an apartment, when we secure the resources. One thing is to get it, the other is to keep it. And I think that there needs to be some level of education and engagement that can be used towards prevention. I know this is deep intervention right now, but I think that we're going to keep having the same conversation unless we really start getting serious about the prevention piece of it. So I just offer that as something for us to think. I know you're not a nonprofit organization. Good God, I don't expect you to do it. But I just think that there needs to be some investments, unlike how we prevent chronic homelessness from happening, specifically with families.
Absolutely. Thank you for that.
Yeah, thank you so much, Councilor Mejia, and agree. And honestly, I think, Lila, I was actually on with a bunch of the folks who work at BHA earlier today, and I think people were also saying, it's so important. It's so important for us to have the services piece, and it's so important, to Councilor Mejia's point, one of the problems with us privatizing sort of even our publicly supported provision of housing is that often like people will get something and then they get pushed out because they couldn't follow whatever rules and regs or, something happened. And then suddenly it's like, if this was actually a public resource, we would be the safety net catching you. Then we're in the weird position of being the public that's in the safety net catching people who have fallen out of like publicly subsidized private housing. But with far fewer resources. I don't know. I agree with Councilor Mejia. It's a real, it's a real area of worry and concern that I think and I think you guys see in your work specifically, you see all of the folks who have not been well served by the various housing systems that we have, whether that's market housing or heavily regulated, other things. So, but grateful that you have these resources and that you're being so thoughtful and intentional about them. And certainly intend to recommend that the docket pass. If you guys could just get us some of the follow-up, just small things on that we asked on. But and I guess if you could also just send us the RFP. I'm sure we could find it online, but just so that we can kind of see what the parameters were that were set, that'd be great. And I don't believe Carrie. Do we have any, is there anybody signed up for public testimony?
We do not have anyone.
There you are, one, sorry. Okay, all right, well then in that case, seeing no one signed up for public testimony, if you are watching this at home and you would like to testify, you can still submit written testimony. We can email that to Juan at juan.lopez, L-O-P-E-Z, at boston.gov, and we're very happy to receive it. But otherwise, thank you to my colleagues, Councilor Flynn, Mejia, and Braden for joining me today. And thank you so much, Lila, and to the whole DND team that stands behind you. And with that, this hearing on docket 1010 is adjourned. Thank you all.